I just thought that was so great of a reframe of remembering what we're doing, that we're providing human care to human care. And without that deep connection and that deep respect, then really what are we even doing here? And I think it's even more important with minoritized folk due to the long history and the lack of trust and some additional factors. And I would say that's probably, well, at least in my mind, the way I'm hearing things is like, that's how we should be at baseline. Because really, again, what are we doing here if it's not a human to human connection?
Hello, welcome to the Integrated Care Podcast from Collaborative Family Healthcare Association. I am the production editor, Grace Pratt, and I am joined by four fabulous friends today. We are in San Antonio at the conference. It's always so fun to do our live from the conference episode, and it's also just really gratifying to be together and enjoy each other. So we are going to talk about all of that. But first, we're going to do our icebreaker like we always do. And I have to tell you, so I just said we're in San Antonio, right? You may or may not know about me that I grew up in Texas. I lived in Texas my whole life until I went to college. And when you live in Texas, the Alamo and the stories of the Alamo are like a big deal. Like we have Texas history. It's not like just one time you get Texas history. It's like the whole thing. In fact, I was trying to describe to someone how the culture in Oklahoma and Texas is very similar, but it's just different enough. And it's just like all of us, the Texas history and the Alamo. So of course I got to San Antonio on Wednesday. I didn't have much on my agenda and my hotel is a block from the Alamo. So I walked on down and walked through and I got my kids souvenirs. One of my favorite souvenirs growing up was the like Texas, Republic of Texas replica money from the Alamo when I was in 5th grade. So anyway, but it feels to me growing up here, hearing these legends, hearing these stories, like it's like, it still kills me that it's a real place that you can go visit. It feels imaginary. It feels like I might as well be going to like Hogwarts or something, that I can actually go to the Alamo. And so I think that probably won't mean much to people that didn't grow up in Texas, but if you know, you know. So my icebreaker question for us, having said that, as you introduce yourself, I'd love to hear, if you could go somewhere that's actual fiction, where would you like to visit on an imaginary trip to a fictional place? So we'll go around the room clockwise to my eyes on my Zoom. And so first we have Jen Thomas.
Okay. Hi, guys. Yeah, I'm Jen Thomas, family medicine, addiction medicine, Morris Hospital in Morris, Illinois, and newly medical co-director. You still get used to that one with Laura Sideri for CFHA. So first time at the conference in that role, which is like fun and very overwhelming at the same time. Where would I go to a fictional place? I think because of the excitement but exhaustion of the conference, I'm thinking of like beach vacations, like somewhere very secluded. So I probably would say like Moana's island. I don't know if it was Montanui. I'm totally butchering that, but like, you know, the crystal clear blue water and a sandy beach and just a lot of like serenity and peace. It sounds somewhere good. I think that's where I would head right now.
That's fantastic. I love that. And now I want that answer. I would love to go lay on a beach. Next, we have Bridget Beachy.
My name is Bridget, and I'm Director of Behavioral Health at Community Health of Central Washington, in Central Washington, all things related to integrated care and primary care behavioral health. And so, Grace, the computer cut out right when you said it's just a place we want to go. We'd like to visit. And
Somewhere fictional.
fictional. Oh my God.
That's because Bridget be living a life. She go to all the real nice places in real life.
Oh, true.
She can't think of fictional.
I'm like, I don't read fiction. I don't watch fiction. I don't know. Somebody watch that.
Yeah, you
Might
can
have
come with
to-
me to the cartoon
You want to
Disney.
be in the universe with hanging out with LeBron? Like that could be a
you
fictional
go.
thing.
Like,
You know, LeBron had the remake that he did of Space Jam.
There you go.
You could go with LeBron to the Space Jam land.
Oh, you'd be so cute, animated Bridget, like shooting your
Yeah.
baskets. You'd be adorable.
let's do that one. Yes, let's do it.
Good job, team. I love it. Thank you, Bridget. Next, you heard her voice, Monica Harrison.
Hello, everyone. Monica Harrison, licensed clinical social worker, a fan connoisseur of all things integrated care, I want to go where the trolls are. The trolls are partying. So I'm trying to be where the trolls are. They got all the type of music you want to hear. The trolls are doing it. I'm going to troll land.
They do. The trolls are where it's at. Yes.
Yeah,
I love
Troll. You
that.
just got to get the fun whoosh pink
Yeah,
hair.
get your hair
I
up.
could do it.
Okay.
I could do it.
You could. You pull it off. You look fabulous.
I'm gonna show you my favorite troll. Bridget has never seen trolls. Bridget, I'm gonna send you a text with my favorite troll in it.
Okay. I love it. And then a surprise, fantastic guest that I roped into joining us on the podcast today. We have Deepu George.
Good afternoon. Well, I guess it's good
I
afternoon
feel like
for
we
us.
should go,
No.
Y'all are my hype people. I like it. Let's keep it up. Good afternoon, everyone. Deepu George, University of Texas, Rio Grande Valley. You are kind of my neighborhood, kind of, because I'm still like 4 hours south of here. Fictional places. One is Rivendell from Lord of the Rings, the Elfin Kingdom. And the other place I just recently finished listening to The Covenant of Water by Abraham Verghese. Really big novel. He's a physician author. But all of that story takes place in South India, in Kerala, where I grew up. And I want to go visit this one large household that he keeps talking about. So
Love that. And then I am Grace Pratt. I am production editor of the podcast, but in my day job, I teach family medicine residents at a community affiliated program in Oklahoma City, Oklahoma. And I asked this question without knowing my answer, but as we were chatting, I thought one place where I would like to go, and this could be that I'm just coming out of lots of kid time and childhood time, but I'd go to Bluey's neighborhood. I'd take my kiddos, we'd go to Australia, we'd spend some time. I'd become a better parent by hanging out with Chili and Bandit a little bit, and we'd go hang out with Bluey. So that's what I would do. Well, we are missing Naftali, as you can imagine. He is very tied up during the conference, and we're missing him today, but otherwise have the whole team together. So it's really exciting. So let's talk about the conference. I would love to hear maybe some first impressions, like how it's been for you. What have been some highlights so far? And then we'll kind of narrow down our conversation as we go. So just what's been a moment that's been a highlight?
I can kick us off, I guess. I was sharing with Grace because I got to see you in the hallway in real life, IRL. Never happens. How cool the coming of age series episodes were with you and Depot facilitating. I listened to those a ton in the recent weeks, just like in the car on my way to work, and listened to Sandy Blunt on the way here from the airport or to the airport, and re-listened to it because it was just so good and just really nice to, because you guys talk about, I feel like I'm still new to this party, like all these great names, the Kirk thing, Kirk Patty, right? These larger than life names, Don Block, these folks that like made this all happen. And I was like, who's that? What's that person? So it was really cool to like spend some time learning the history, and then phenomenally humbling to then meet some of these people in real life. Like I sat next to Frank DeGry or DeGrew. How do you say his last name? I'm going to butcher it, of course, here.
DeGrew.
DeGrew.
DeGree. DeGree. Oh, I messed up.
Like Frank, he talked about his fancy shirts that are all like colorful. I was like, is this one of the shirts? He's like, it is. It was just really neat to like meet those like real life hero type people, and really imposter syndrome to like, okay, I guess we're doing the things. And it was cool though, because they were very like, all right, you guys have the baton. Like this is something that you're gonna carry forward. So go out and keep doing it. I was like, okay. It was great.
I love that.
I think for me, it's just a lot of gratitude for the 30 years. And we, believe it or not, for those of you who are not able to make it to the conference, a lot of the people who laid the foundations for who we are as a community, and then of course influence integrated care from all aspects of integrated care, they're all here. And Mac Baird kind of shared in his reflections yesterday of like passing the light forward. And I think that was a very meaningful moment for me. And so just a lot of gratitude. And being in San Antonio, if you look at all of the conference presentations, there's a lot of variety of storytelling around where is integration moving towards, or in addition to very strong presence in primary care, how is integration principles influencing other areas of the medical world? And so that's very exciting to see some inroads being made beyond where we are currently are. So very happy to see that.
Well, I'll go. You guys, my introverted self, still always loves coming to the conference to meet new people. So the networking and the tons of new people I met are always number one on my list. I've had a sense this year, however, as well, that individuals are just much more willing to ask questions and engage. Like normally in the sessions I've done, I know it is just Friday morning. We're not even 24 hours yet into the conference, and I've had two sessions and attended to support colleagues separately. And in all four of those, individuals asking questions, like not waiting to the end for you to say, what questions do I? No, we got questions. We're getting ready to, what do you mean by this? And that to me, I'm not used to seeing. I'm used to seeing people kind of wait to the end, or people might not say much because no one wants to feel like out of place with asking a question that might sound stupid. I feel like someone else might know more than I do, all of that, so that individuals typically sometimes feel self-included in these sessions for whatever reason. Individuals are like, okay, wait, I have a question about that, and let me ask this, and then someone else, and more willing for collegially individuals to talk to each other. Like, I've experienced that. Here's what we did. Like, that is happening in the sessions and not just when I'm used to seeing it kind of happen in the spaces that we give for that to happen outside of the sessions. I'm seeing it happen inside the sessions. I just feel like it's more engaging this year. So I don't know, it might just be me.
Really putting the collaborative and the Collaborative Family Healthcare Association, right?
Yeah. Yeah, I think it's so fun always. I probably have the same answer every year on this version of our podcast, but it's just literally just seeing everybody in person. And I know we've talked about this before that for me, CFHA is the place and it's the time to kind of get rejuvenated and have that connection piece and get grounded in why are we doing what we're doing. And so it's just been really great to hear so many folks that are doing good work out there and knowing that, it's working and people are doing it. And that's like one of my favorite parts of the conference is when somebody just comes up and says like, "Hey, I'm a new BHC," or "I'm a new director. We just hired more BHCs, and I'm learning the role. I watched your videos, and it was helpful to me in this role." And you're like, "Oh, okay, so it's happening."
Yes.
I feel like you can see the ripple effect, which is so cool. For me, it also is those moments of connection. I get to come to CFHA mostly as just a learner. And so being with her, I'm not presenting anything this year. I'm kind of here for the ride, here for the vibes. I was joking the other day. And so just like being with people and then sitting in that learner seat, but also like I was sitting with Monica and someone came up and she was talking, "Oh, you need to make a connection with this person." I was like, "Oh, I know her. She's wonderful." And so these moments of connection and the small world that we live in and making it all so personal is really lovely too.
I think some people have been genuinely surprised. Like Jen was talking about the luminaries that are here, and as a board and staff, we got to have an intimate dinner with them last night, and I agree, it is like really humbling. And what I recognize for a lot of our attendees, like Deepu and Bridget are it. Like I would be talking to a group of people and they'll be like, "Oh, that's Bridget right there, right?" And I'm like, "Yeah."
Yeah, they're
Like,
like
"Yeah."
fangirl. They're
And
like,
they're like, "Oh, that was Deepu." Yeah.
see Deepu. Oh my God.
Right. Like super excited. And so
Yes.
it's a little like not weird in a bad sense, but just like odd because it's like, yeah, that's them. They're cool people. Like they will talk to you, and recognizing we feel that way about the luminaries. Do you know what I mean? So yeah.
Yeah, I had a lot of folks come and talk to me like newbies, and it was really great. Just kind of just saying, "Hey, I'm new in my role," or asking a question. And I know that Neftali and really the whole CFHA staff, really everybody who goes through CFHA encourages that. right? To like talk to people. And it's been really fun to get to know so many different folks and stuff. So yeah, it really is a very personable conference. And I know that DPU had used the word. Didn't you say that your one colleague, you had said that you love this organization? And he was like, that's a weird way of describing a professional organization. And then he like wanted to join or did join or.
He's gonna consider joining. He's a psychiatrist, and when I talked about CFHA, I said it's a very loving organization.
Ah,
And he said he was just very surprised at the use of that word to describe a professional society, right?
Yeah.
Because
Yeah.
that's not what
Yeah.
people associate conferences with, being a
Yeah.
loving place.
I agree, Deepu, and I think the medical conferences shade my own people, but like they can be kind of stuffy. Like, not that they're bad, but there's a difference, and you can hear it from one person, but you hear it from 20, and everyone commenting like, oh, there's just a different feel. And I think, bringing that energy and just allowing ourselves to be open and vulnerable and have some fun and let loose a little bit isn't always present at other conferences. So heck yes, this one definitely has a different feel, and so thankful for that. And that's partly why we're really, Laura and I's task with CFHA's getting more medical people here. I think we have 75 medical professional registrants for the conference. 75% were physicians, the other quarter were nurse practitioners, PAs, and so forth. But I mean, in prepping for all this and reading up, I'm like, we have like something like 1.1 million healthcare providers in this country. Like, that's a lot of people. So like, there are people, they just don't know it yet. So like, we need to be pulling up more chairs and getting more rooms and just having, I think again, it's not that medical doesn't know about integrated care, but it depends where you trained. Like Andy Blair shared, like, oh, I always grew up this way, my residency, and that's awesome. It's awesome for, folks like Bridget in the, training programs, and Grace, that generation of medical providers will just grow up knowing this. And I'm not that far out of training. I finished in 2010, and I learned this. This was all like, what? You can do things this way? That's amazing. So yeah, I think it's great that even us mid-career people find a home that, like, you're never too old to learn. So you can take a page out of someone's playbook and do it in your own health system and be a little change agent there. And what amazing things you can grow. The greenhouse, man, Deepu, that you're onto something there. That's such a great metaphor.
Yeah, I was gonna say, I think CFHA is a loving organization because our leaders, like Deepu, like Bridget, like Jen, like Monica, lead with love. And I think that's really beautiful. So that does lead me into my next question is, what's something that you have, been happy to prepare and to bring to this conference in terms of teaching or sharing? Because I know all of you are so involved and are in important roles. So what was something you brought that you're proud of?
I'm going to go first on this one. My team. They have had, I've been able to go to as many of them as I can. Sometimes I'm presenting at the same time or whatnot, but seeing them shine has been amazing, and seeing their contributions. And it's very interesting because, you work with them, but I don't always get to see what they're doing. I feel like we've said that before. So to be able to sit for an hour and hear, Emily Faust talk about, what she's working on, what she's bringing to the clinical realm was just like a really cool experience. And it's like, well, don't you work with these people? It's like, yeah, but when at work do you have an hour just to be like, oh, so what are you working on clinically? So that's the thing that I've been really proud of, and just seeing them everywhere. And it's just a really like ridiculously proud moment to see everybody enjoying the conference.
Yeah. Same. I brought a +1. I didn't bring the whole team next year. My +1 is Kathy Levy. She is my work ride or die best friend, nurse practitioner. We've worked together in our tiny little clinic in Gardner, Illinois for 11 years, and she's phenomenal. She is celebrating, get this, 40 years at Morris Hospital. She's RN background, ICU, did palliative care education department, went and got her nurse practitioner degree. She's now one of the only, I think, still buprenorphine prescriber in Livingston County, Illinois, which was previously a treatment desert, designated by the state. Like, hey, ain't nobody prescribing this in this county. What are we going to do? Kathy steps up to the table. So she's a friend and a real mentor of mine. And she's here for the first time. So really proud to see her. We're presenting today at 2:45 about the CHAMP study and OUD and collaborative care models. So come on down. But yeah, happy to see her get a chance to shine and share her story too.
I would say people, yes. I mean, our team always comes, but also I always have an opportunity to talk up CFHA with contracts that I have. And so there's a couple of contracts organizations that I've worked with this year that are here as first time attendees. So I'm excited about that. So people always, yes. And I'm actually not doing as many sessions this year. I'm doing two, but not doing as many sessions this year, which means I have more time to actually slow down and listen. So being able to bring that part as an active and reflective listener, I've learned some things too, and there's some things that need to be worked on and brought to the table. And I'll put it out there just in case there are individuals on the podcast. I've had two individuals specifically talk to me about wanting more literature from people of color in terms of books written by people of color around integrated care. And so those out there listening, I am a person of color. Oh, I don't know. I might need to partner with somebody because that just seemed like a heavy lift for me right now as I think about it. But for those out there who are in that space and love writing and editing and all of that and all of those things, and you are identifying as a person of color, just know that there is a request and a need. So being able just also to hear like some of the things that people are interested in is the other thing, the reflective, active listening piece.
Monica, will you autograph my book when it comes out, when you publish
I
it?
was gonna say whose book, because girl,
You, your book that you write, that I'm gonna need to autograph it.
gotcha. Okay.
Okay.
Speak it into existence, right?
No, we did. Oh, go ahead, Deepu. You go ahead.
Oh, no, go ahead. Finish up.
I was just gonna say we did myself, Dave, Stacy Obide, and Meredith Williamson. We did Scars of Leadership, and it went really good. And it was a really fun space to be vulnerable in to talk about some of the difficulties associated and one of the thing some of the things that you do to get through it. And so that was a really good present. I think it was a good presentation. I had fun and I learned stuff from Stacy and Dave, even though I talk to them all the time, and Meredith. And then we are doing a contextual interview live and in color. We're doing a sample, like a demonstration, and I'm going to be the patient. Dave's going to be the clinician. I already have a patient all dialed up. And so that's going to be happening from today.
What time? What
So.
time today?
4 to 5.
4 to 5. I'm so there. I'm so there for it, Bridget. I got a shout out to our amazing staff. Like, this has been an eye-opening experience to see the behind the scenes magic. Like, you take for granted, I think, as an attendee and a provider and a healthcare professional. Well, and we know the importance of team, right? But oh my gosh, to put on a conference of this magnitude with this many hundreds, 700 plus attendees, the quality of content, national speakers. I mean, it's air traffic control. And I don't know how Jackie does it. She is a goddess of multitasking. And Daniela and Martha, Liana, Hannah, they are really teammates of ours, champions of the work. We wouldn't have this beautiful time to gather and learn were it not for them. So huge kudos to that team of wonderful professionals. Thank you for making this happen.
Yeah. I mean, the staff is, we've grown a lot, and a lot of them are newer additions in the last 6 years, and they have just stepped up to the plate. Things that I'm thinking about this conference, one is my team is presenting independently on their own. And so that's very exciting to kind of see them do their thing. I wasn't part of like submissions or anything like that, this whole process. So it's really cool to see that they took initiative and they're kind of doing their thing. And for me, it's just been about framing history and providing a lens to kind of think about where we've come from and kind of moving forward. And so that's where most of my headspace has gone to and it's been sitting in. And then Monica knows on the other end, we've been thinking a lot about strategic planning for the organization and kind of things around that, which all of you, the members, will hear about it next year.
I'm curious to hear what's been a moment of connection for you. I mean, we're talking about our teams and our people, but is there anything that stands out as a moment when you really did feel connected to purpose or mission or whatever it is, in these last couple of days so far already?
Well, I mean, last night was a big connection point for me with all of the luminaries here and to hear from them directly, because some of them were talking about how they've been in professional societies and other things, but how they've been kind of honored and cared for was not the same, and they appreciated the difference. And just the fact that we have people like Frank Degree and Mac Baird fly down to be here, and they haven't been part of CFHA for years because they're all retired. So just kind of spending time with them. We had an amazing board meeting, so I got to spend a lot of time with Monica and the rest of the gang. That was like a huge moment of connection for us. And so, and then this moment right now, Dave and Bridget, always on the list. Standard itinerary. So those are the things that stand out to me now. I'm sure there's going to be more between now and Saturday.
Yes,
Yeah.
I like the serendipitous moments. Those like, I didn't think I was going to meet that person, but this turn in the hallway, like, so I lost my computer this morning. I got up after talking to Beth, and I was like, oh, I was like, I don't have it with me in the session in Mission A. So I'm like, crap. So walking down the hallway, stressed look, and a very nice gentleman, and I'm going to forget his name, and he was amazing, but he was in SLU in St. Louis, and he was like, did you lose your computer? Because it's up in the front desk. And I was like, oh my God, thank you. I wouldn't be on it right now doing this recording with you guys. We got to talking, and I'm like, I think that's the universal nudges and the serendipity of meeting in person is you never know where those little connections bumped into the right person, right time, and where those things can go. So that's just always a fun little surprise nugget of getting to come and be together in person.
Jen, did you meet Max Zabatsky by any chance?
Yes, I did. That's his name. LMFT, maybe.
Yes,
Yeah.
he is. And I was going to say, like those threads of connection, I'm just always reminded what a small world we're in, because a big moment of connection for me was I came in early enough to go to the MedFT summit that they did as a, ELO at the beginning of the conference. And so being able to just kind of gather with people that have that same identity as family therapists. And I didn't know that she was going to be here, but my dissertation chair and mentor, Angela Lamson, was there. So I just walked into that room, and the warmth of like seeing her, and a lot of life changes when 3-4 years go by between when you've seen someone. And even our summit was hybrid. So there were people that joined virtually too. And even seeing friends' names who aren't here in person scroll across the top of the Zoom window. And, I would text and say, oh my gosh, Natalie, I just saw your name. Hi. Oh, hi, Emily. People that we're connected even if they're not here. And Max is one of those people, like sitting by him and talking and sharing ideas. So that was a big connective moment for me.
I think a connective moment for me was in a session that I actually did. One of the sessions was on wellness planning, relapse prevention planning, stay well plan, whatever terminology you want to use for it. But in that conversation, we've been having some conversation, and I think last year I did a session on like going outside of the models and just about providing care to the patients on the continuum, like period. And so in that, to hear the attendees say, oh, here's how I could use it, and I do bidirectional work. And here's how I can use it, I do harm reduction work. And here's how I use it when I'm doing PCB. How I use it in collaboration, right? Like individuals to be able to take something and see how it fits in their work, regardless of the type of work they're doing, which is, I think, is what we have been trying to get at. Like, yes, there are pieces that are specific to the context of your work, and there's a kind of general spirit of integrated care and us figuring out how to make this work for the population that we're working with and for the team.
That's been really the fun thing for me about our coming of age series. We have 5 episodes that are out, and we keep talking about the luminaries who are here, and those will continue to come out as we're hearing those stories of these 30 years. And I think the ingenuity that's inherent in our field of like this shared mission, shared purpose to take care of people and to collaborate. And then that has developed and flourished into, over the years, incredible models and research and ways of working in this beautiful, like scientific production, but still always coming back to the kernel of, okay, we're a person sitting across from another person in a room on a team taking care of patients. And so hearing those storylines, for lack of a better word, how they've carried through is, I think, really powerful. And what's something that you're learning?
Well, I'm going to go to a few sessions. Hopefully I make it to some, other than all the meetings I have in between. And I'm hoping to pick up some things. from the two keynote speakers, I definitely have taken lots of notes, and Dr. Carolyn Tucker talked particularly about this program where she trained religious folks or pastors to be kind of mental health coaches. And I think that's a great way to kind of enhance reach, kind of thinking beyond licensed individuals to be the only source of mental health care. How can we kind of democratize some of that? So that was something that really stayed with me. And then from the plenary talk this morning, Salud America, I think that'll be a good resource as well. I think the presenter was like, do you guys have any questions? And nobody asked any questions. I think it's mostly because she was very clear. Like she gave like 20 different resources where people looked up things. And so it's like, yeah, but now we just got to go home and do the work, right? And so hopefully someone told her that. If not, hopefully she's listening and she hears them.
Yeah, I took a picture of the one slide of cultural sensitivity behaviors identified in the Black women focus group participants, share respect for the patient's religious beliefs, chat about the patient's week and family before focusing on weight, be compassionate, sensitive, and understanding, saying, I hear you, I care. Say you want to earn the patient's trust. I thought that was a great nugget. Give a lot of encouragement and praise for efforts. I guess they're talking, specifically about weight loss, but really regardless of, praise and encouragement with whatever the person's working on. Ask patients how they want to be addressed, of like the title of like, miss, and then listen more and talk less. And I just thought that was so great of a reframe of remembering what we're doing, that we're providing human care to human care. And without that deep connection and that deep respect, then really what are we even doing here? And I think it's even more important with minoritized folk due to the long history and the lack of trust and some additional factors. And I would say that's probably, well, at least in my mind, the way I'm hearing things is like, that's how we should be at baseline. Because really, again, what are we doing here if it's not a human to human connection?
Now, let me make a plug here for the contextual interview instead of Bridget bringing it up this time. Because in CI, the fundamental equation is respectfully, personally curated, customized ways of knowing people. When people are seen and when people are understood, change becomes a lot more easier. Change becomes a lot more possible. And, when we talk about the bigger concepts of equity and things related to equity.
Uh-oh, our crew got frozen. Are they frozen for
Hey,
you or is it just me?
Nope,
it,
they're back.
it,
Oh,
it froze at equity. I was like I was
yeah,
hanging on
I
every
know.
word that DP was saying.
Like, oh,
What, can you hear us now?
Can you guys hear us now?
It went all the way up until equity. I don't know, Monica and Jen, if it was like that for you.
same.
It was a
Yeah.
really good point.
Well, let me
Go
see
back.
if I can go back. So I'd say all of our conversations about equity, and Bridget, David, and I talked about this a little bit, right? What is equity in a clinical visit? Equity in clinical visit, because you can't, in that visit, you're not going to go and change all of the structural issues that are perpetuating the inequities. You're not going to resolve the traumas that people feel because of all the set systems in place, right? You can't do any of that. But in a clinical visit, equity is being seen. Equity is being known, right? And equity is being believed in the stories that you have to say, that the other person who in this relationship has a little bit more power than you as the patient. But as long as the other person is listening, tuning, and believing, I think it just kind of sets in a much different frame for any conversations about change. Because I think the challenge with the way we deliver care is we have solutions. And, Bridget has this like great PowerPoint where we said we bypass the personal context and their culture and ACEs and all the cultural intelligence that they bring directly to interventions, right? Like we can't keep doing that if we want to help people see themselves and reconnect back to themselves, because then people feel safe and they're ready to change. So I'm gonna go because I gotta go get ready for a presentation. It was amazing for me to be back in the podcast world with you guys. I hopefully will be back in the spring for good because I am handing out the baton as the president and it'll go away. So I will be back very soon.
Well, we're saving your seat. We're all really thrilled about that. Thank you for making this time.
Of course.
That's
Yeah.
awesome. I'm taking that cultural intelligence, Deepu. I like that word or phrase.
Let's talk more about that word.
Oh, yeah. Get that for fodder for Saturday.
Yeah.
Bye, guys.
What's something else?
I guess I went to a really awesome session this morning on the Waco guide. This was at How Did I Never Hear of This? So technology meeting the needs of PCPs with med prescribing. It's a algorithm, but there's more to it. It's two family medicine faculty at an FQ in Waco, Texas that like got this all going. I think they said 7 years ago, and it's free. How about that nifty piece of like, we want to put this out into the world so that providers can prescribe in a more evidence-based, intelligent way, and we're not going to charge you for it. That's
We
cool.
love the Waco guide.
I've never heard of it till today. And the people I was sitting next to are like, this is should have had this forever ago, you know? And to Monica's point, other care team members, you'd think, oh, it's just the prescribers in the room that care. No, we had a lot of VHCMs that were like, oh, okay, so like I could pull up fluoxetine and then like know the anticipatory things to help coach people through if they had some temporary side effects. So right there, it was like a tool that many people are going to use. It's so great. Yeah, Waco Guide, 2 thumbs up.
It's a fantastic resource. And you talking about, BHCs enjoying and using it kind of brings me to a session that I went to that I learned a lot from. So Randall Wrights and some colleagues, Alex Holst, Maya Obsfeld, Tanya Cook, and Iman Attar, they're all in the Grand Junction world. And they were talking about defining scope of practice for BHCs and really understanding and being intentional about putting the scope of practice around that, which can get tricky when we're working in different settings or, we're wearing these different hats in that role. And they came up with a really nice tool that's a framework that I think I'll use with my learners in terms of, hey, like there are some boundaries for us. And also there's a lot of things you don't have to be afraid of. You don't have to be afraid of asking people about if they're having side effects or talking through that with them and making a role usually of then empowering them to talk to their team members or, to serve as a translator between the patient and the prescribing provider, et cetera. But these tools, I think that strengthen all of us. And as we lean into our roles are really helpful. So it was good for me. I kind of have this, like, I know my role, I know what I know, because I have all these years of experience. But when I have new clinicians come in, when I have new interns, when I'm talking to and teaching therapists in the community, they don't always, know to differentiate, okay, well, I don't know what's my role and what's not. And so I thought that was a really helpful tool. And then the other tool that I screenshot was in Dr. Tucker's plenary. She shared a number of inventories for like self-evaluation and patient evaluation and evaluating the clinic as far as really practicing from a lens of cultural sensitivity. And so I was thinking about, incorporating more of a reflective piece in my teaching in that area. We spend a lot of time talking, we spend a lot of time reflecting, but when there is a tool that I can bring in and incorporate into my teaching, I think that's going to be fantastic too. So I saved I just like screenshot that whole slide she had. I was like, I'm going to go dig into these things.
Guys, this is a little bit more meta than literal as far as like what we're learning. But one of the things that I am learning from going to the different sessions is that I feel I'm in the right place with seeing patients and growing our team. A team that goes and does the work, as very clinical. I identify as a clinician, and sometimes, you feel guilty about maybe not doing as much research or doing this or that, or like it somehow is less than, because it's like, oh, well, I don't have that many peer-reviewed papers or whatnot. And the few that I do have, they're not hard research either. They're not hard research papers, I can guarantee you that. And so, kind of just thinking that there's a place for everybody to bring their interest, their joy, their talent, whatnot. And so I don't know. I don't know why it's taken this long, but I just kind of feel really connected to being a clinician. And it's not like with a little asterisk next to it saying like, well, but I wish I had more peer reviewed, or, well, I wish I was doing this. I don't feel that way. And I think it's a really cool feeling.
I love hearing you say that, Bridget. And I think that when I'm at CFHA, I feel such a connection to like the really clinician science practitioner model, that it's all about like what we're actually doing. And it's not just research for research's sake. And I mean, I can look at you and all of the different ways that you use your voice and you teach and you consult. And it's so clear to me, like what an incredible impact that you have on our field and so many people who learn from you in a million different contexts. That has nothing to do with how many lines are on your CV, because you are like, you're teaching and you're leaning in, and that impact is so visible. So I love that you're feeling a little bit of that reflected back to you here.
Yes, totally that. And I'm sucking at remembering the names from the coming of age, but one of the speakers, she was female, talked about the hard sciences and the hard to do sciences. And boy, did that hit home, right? I was like, that's you, Bridget, hard to do, right? Like the secret sauce. How do you do this in the real world? And boy, that was just so true. Jerry, maybe, I don't know. We'll have to look back, but I just thought that was a neat, like, shout out to like the frontline real world clinicians,
I think it was Jerry Hepworth. And, one of the things that I loved about that conversation, and I left just marveling, is she talked about, if you haven't listened yet, go back and listen, because I won't do it justice to how she told her own story, but she talked about how a lot of her leaning in and decisions and participation in the growth of CFHA and integrated care was an effort to really distinguish herself from her husband and like separate out like what he was doing in a similar field versus what she was doing. And I'm like, wow, how much did we get because she was like determined to prove herself, and like prove herself she did, and what an impact in our field. So I don't know. I love Deepu, and I'm glad he was with us, but like, yay, women.
No, I appreciate you guys, support so much in like, I really love being a clinician and doing real world stuff. So, you know, like I feel, I, I just feel I'm in the right place.
We're getting close to the end of our time. Other takeaways that you guys have, or hopes, as the conference isn't over, we still have some more time, although I do fly out late tonight. But what are some hopes that you'll carry with you from this place?
Just keep the spirit going, catch this lightning in the bottle feeling and take it home, take it on the plane, and don't let the candle blow out. And because it's like life kicks back in, right? All the blustering things, the hurricanes and elections and our personal work-life balances, all that stuff that's like, it really can make it hard to keep that vibe going. But it's connection, and thank God for CFHA. It's something you can connect with many times throughout the year, and that helps.
People are
It's really
coming
well
out
said.
of their yeah, people are coming out of their discussion groups. So there's a lot of noise. I don't know if y'all can hear it behind me, but these are amazing headphones. There's a lot of noise from the people coming out. You know what I would say is my hope is that individuals are sparked by something they heard this year, go implement, test it, and come back and present next year and tell us how did it go, right? Like, we saw you in San Antonio. Here's what nuggets you got from Jen or Bridget or Grace or whoever. You went and you tried this, and here's the data that came out of that. And you're in North Carolina with us next year sharing.
Yeah, that's good. And getting there, I think that it's important to get here. And I know that it's hard to leave the clinics unattended to, but as much as possible. And I know finances, on and on and on. But if you are in charge of anything, take your team if you can. I mean, I said we'd take the entire team. We had 3 people choose for different reasons not to come, but the other 20 did. And I think that it's important for us as directors to invest in our people. And if we don't have a well workforce, we're not gonna be able to do the work. So if humanly possible, use some of your chips and get your peoples here and allow them to absorb in this.
I love that. And I mean, I hope for connection and growth and just more of the goodness, right? I love what you said, Monica, of like bring it here next year. You know, it's easy to minimize, I think, the work that we're doing individually. We're like, oh, well, it's not that big of a deal. I'm just doing my job, or like, I'm just doing what I'm supposed to be doing. And my hope is that we'll stop minimizing this incredible impact and this incredible work that we're doing, because like every day, first of all, I love so much. This is the second in-person conference I've been to this last couple months. And I love when people tell me that you listen to the podcast. And so like, I want to speak to every single person who's listening of you are doing something important. And I hope that you feel that. I hope that you feel validated. I hope that you feel compelled to share that work that you're doing, because it is powerful and it's worth talking about. And yeah, you're doing your job, but you're not just doing your job. And so I think that's the hope that I have, is that we can keep amplifying this incredible work that's being done in our field, because we're still change makers, you know, like 30 years in of CFHA, more years in of integrated care, we're still making a difference and there's still work to be done. So taking up this mission, taking up this call and getting your hands dirty and then reporting back and being with your people, like, you know, that's, I think, as much as we can hope for. Any last thoughts? Anything else anybody wants to say? Okay. Well, I'm
We all
so
trying to
thankful.
get to the next session.
We are. It's time to go. We need to go learn some more.
We don't want to miss out.
No, well, I am so thankful for each one of you. I'm thankful I've gotten to give a physical hug to each of you and to be together in person, but I love hearing your voices every month. I'm so glad we get to do this all the time, and I'm thankful to our listeners. Just, you know, thank you for being here with us. We'll talk to you again next month.